Good morning and welcome to the Paramedic Services Committee meeting for March 1st, 2023. I've taken attendance. I want to welcome everybody, and I want to open the floor to the election of chair, please. Councillor Pierce.
Councillor Miller.
Councillor Miller, do you accept?
Yes.
Is there any more nominations? And can I get a motion to close nominations? Okay, and Vice Chair, open the floor for nominations for Vice Chair.
I'd like to nominate Councillor Sicoli.
And Councillor Sicoli, do you accept?
Yes, I do.
Is there any more nominations? Councillor Pierce? Thank you. Thank you. And Councillor, you have the chair. The mayor is going to make a motion that the update from Daryl goes in camera. When we get to
Update from Daryl.
yeah, Daryl has a verbal update, and we're going to do that in camera.
Okay.
He's going to make a
Okay. Thank you, Nancy, for getting us this far, and I would like to welcome everyone to our inaugural meeting for this term of council. A little late, but better than never. Approval of the agenda. So I'm going to look for a recommendation to get it on the floor, and then we'll see if anybody wants to add anything. Okay. Yep. Yep. Seconded by Councillor Sicoli. Hold on one second here. Mine's not. This is not on. Oh, okay. And I just need it on to see Mayor Davis. Okay. Does anybody have any additions to the agenda or changes? Mayor Bailey.
Mr. Chair, I just want to move 11.1 in camera, please, for the negotiations, the verbal update from Daryl Lee.
Okay. And I'll look to the clerk. If we put that in camera, that would be classified as we need certain reasons to put something in camera.
Negotiations.
Under that then. Okay, any other additions to the agenda? Okay, seeing none. And Mayor Davis, if I miss you, just don't be afraid to shout out, but I'll keep an eye on you. So, okay, so all in favor of the agenda?
You can count on it.
What's that?
So you can count on it.
Okay. All in favor of the agenda as amended? Opposed, if any? Okay, and that'll take us to item 6, adoption of the minutes from the previous meetings. Can I get a motion to get it on the floor? Moved by Councillor Pierce, second by Mayor Bailey. Are there any corrections or omissions on that? It was long ago. The nice part is we still have a few members from that, which is nice. So, okay, see none, I'll ask. Okay. Thank you, Nancy. Okay, we have a mover and a second, or all in favor? Okay, thank you. Any business arising from those minutes? Okay, seeing none. We have no consent items. Staff reports, we do have 2. So what I'd like to do is just get them on the floor, and then I'm going to ask if we could get staff, Russ and maybe Heather, to speak to any of those. And then if we have any questions or discussion, and I hope we have some, we'll do that at the end. So going to 9.1, is a recommendation on the floor to receive as information. Can I get a mover for that? Moved by Councillor Martin, second by Councillor Sicoli. Okay, Russ, I'm going to go to you. Is there anything you want to point out? It's a lot of information, and if we were a private business looking for increased business, is a good news story, but I don't think we see it quite that way. So, what can you share with us?
I wish it was a good news story. Some of the councillors that have been here for the last couple of years in our ambulance committee has seen the growth in our overall call volume. Nobody expected over 21% growth in our calls, which is another 5,500. So since 2014 up to 2022, we've had a 72% growth in call volume And with the help of the counselors here, we've increased our staffing of about 33% overall. We're still chasing it. We didn't know what was going to happen during COVID or post-COVID, what was going to happen with clinics and everybody else looking for medical care. So our crews are doing their best right now, but we're still basically being delayed further and further for offload delays at the current hospital. If you can see our chart, we started off with very minimal offloads where improvements up down to as low as I think 34 minutes was our best. Now we're 58 minutes, and our time on task right now is almost an hour and a half or more per call, just because of the delays of getting our crews off. The good news stories that we have, besides that's what's in this report, is that looking at new ways of innovative stuff to basically save on overtime and getting our crews off in a more positive manner. Last year, we spent an additional amount of money in taxis trying to taxi crews from their stations back to the hospital. We were able to secure 4 RAV4s. The crews come in right at 7 o'clock, start the Toyotas, go over to the hospital, relieve their crews, which is saving us anywhere between 5 and 7 minimum hours of overtime every day, and the crews get home to their family at a reasonable amount of time. The RAV4s cost the same amount or less than we currently were paying for the taxis throughout the whole year. So we're just trying to keep things going with our staff. We were also awarded back in mid-December $152,000 for additional offload nurse funding. We finally launched it just a couple weeks ago. There was other paperwork that we had to go through, and since then it has made an improvement. But that funding will end as of March 31st of this year, and we go back to the standard offload nursing only 7 days a week from basically 10 till 7 p.m. If anybody has any questions regarding my report or any of the statistics I provided you, please let us know.
Okay, so I'm going to look to the committee. Is there any questions or comments? And we'll take comments to it this time because it's an information report. So I'll go my left to right. Councillor Martin, you go first.
Thank you. Russ, with the emergency, it's obviously triaged and the most serious cases dealt with first. But when 2 ambulances take in low priority patients, is there some reason why one ambulance can't look after the 2 of them? If they're that low priority, they should probably be sitting in the waiting room with no ambulances standing by. But is there any way we can double up or triple up on patients and free up an ambulance or 2?
Through you, Mr. Chair, the process of doubling up on stretchers, what we require to do that for 1 paramedic to watch 2 patients at any given time is they cannot be left on our stretchers. Ministry mandates that 2 people must be available to basically monitor or basically not restrain, but keep the patient safe on the stretcher. So what we require to do is if the hospital would allow us to offload into an empty bed, then 1 paramedic can watch over 2 at this given time, but the other way of watching them both on the same stretcher is not possible. We've initiated that already. We've also asked the hospital to increase or enhance their Fit to Sit program to work on other solutions for our paramedics to get off the road. But right now, in my report, as I said, if the nurses have a ratio, and I'm not quoting the ratio, but say it's 10 to 1, if they are down 1 or 2 nurses, they cannot do like 15 to 1, right, for their overall patient staffing. So that's why we, in our deployment plan, are continuously trying to change to mitigate the offloads to get our crews back on the road.
And do ambulances ever take people in that could be eligible to just sit in the waiting room instead of laying on a stretcher?
Through you, Mr. Chair, there is a Fit to Sit program that the hospital provided a criteria, but if the waiting room is full, we are there. Also, if we bring, say, a patient in that is not able to ambulate, but maybe I'm just using an example like a stub toe or a broken toe, but they're on our stretcher. It could be a senior citizen, somebody that's not able to ambulate. We cannot offload them into the waiting room, right? We're there with them at that point in time.
Okay, thanks.
Councillor Sokoli, go ahead, please.
Yes, thank you. Through the chair. Russ, have you ever explored collaboration with, say, like the fire department? And I'm just looking at here where we see that there was the code 2, which means you have less than 2 ambulances available, correct? And it's my understanding that like the fire department has, some of their firefighters have the qualifications that would be required to provide the paramedic service. Have you ever had those discussions with the fire department to see if we could call on them in those emergency situations where we're at a code 2 to help out to reduce those wait times?
Through you, Mr. Chair, we currently have a deployment plan with the current fire chief and the previous fire chief at the same time, looking at certain criteria that we're willing, and we do collaborate on them going to calls, but at the end of the day, we will still need a transport vehicle. So even if we are down to say 2 or 0 vehicles, they provide care, we still need a transport truck at that point, a transportation vehicle at that point in time. So we have mitigated through it, and the previous chief, currently to the one before us, did a certain amount of calls. When COVID hit, we basically drew them back rather than contaminating the fire department at the same time dealing with COVID. And now we're slowly having other conversations and working through different mitigation. But Chief Binkley through the city and working with Chief Darren Watson in the county, we work well together to do so. But again, we're mitigated by transports.
That's brilliant. Thank you. I think there's some synchronicity there that we might be able to draw upon, and I would encourage those conversations to continue and keep up the good work. Thank you.
Councillor Pierce.
Thank you, Mr. Chair. For me to Russ, first of all, Russ, it's a long time since I've said it. Thank you for all you guys do.
Thank you.
I know you guys are stretched. The stats say that. I've said it for years. The numbers don't lie. They are what they are. It's crazy to think that, we were talking about a, say, 8-9% increase in calls, and seeing 21% increase is scary, to say the least. And, there's probably all kinds of, you can put some answers maybe to some of it with our aging population and that type of thing. But just the number itself is kind of scary. What I really want to talk about, and you kind of alluded to, we were there with the offload. So the offload time being now, almost an hour for the sake of it, that's pretty much 20 minutes more than it was in 2021. Do we feel, and again, the sheer volume of calls, when you think that, those number of calls going in, and as Councilor Martin said there, and we've talked about before in regards to, unfortunately, when somebody calls an ambulance, we're getting to the point now where we might be able to treat them at home if it's not critical and that type of thing, but it still takes time. So that's a unit that's off the road with a couple of paramedics on there. Do we feel, or how do you feel that this additional offload nurse at the hospital is going to help us reduce that wait time at the hospital? And do you feel that it might be something that we need to look into getting an additional one, or would that help, or would it just kind of make things more confusing?
Through you, Mr. Chair, back in 2014, the province did provide us base funding for the first offload nurse. The guidelines of that offload nurse was to have the offload nurse to care up to 6 patients, additionally to what the hospital is currently funded for. What we're limited to, and we found out since 2014, is the amount of real estate in the hospital. Right now, what they had to do because of real estate is they merged, we'll call it the original offload nurse, into Zone 2 to help mitigate with their real estate. The province put out a request for additional funding back in, I think, May or June when we applied. The province had $17 million worth of requests throughout the entire province. The province gave $7 million, and it was divvied up between all the communities that applied for this additional funding. We were fortunate enough to get $152,000. With the extra 6 beds, working with the hospital in collaboration, they've provided us 6 hallway beds. We cannot use the existing hospital staff because they are stretched. We've worked out an agreement with, as we've heard probably in the news, agency nurses that come in from other jurisdictions to watch over the patients, but the agency nurses are starting to be stretched thin. Since we launched on February 15th, we've had 7 different occasions that the agency nurse just has not shown up. So our additional bed there, we're hoping that by using the additional $152,000 and showing the province the need, that moving forward after April 1st, additional funding will come in and being on a more permanent basis, that the hospital could go ahead and hire 4 to 6 permanent nurses to be part of that additional real estate to help us out. But since we've started, we have a chart that we have a live dashboard. Within a minute, we can tell how bad things are and the length of time and the offloads and stuff. It has decreased and helped us out immensely. We're still working through the kinks. It's a brand new thing, but we're working through it, and it has helped immensely. So if we could have an extra dedicated offload nurse 24/7, allowing us the 6 beds in the back of the real estate, that would lessen the burden because we're now 6 deep. And even if that offload nurse could take our patients 2 hours earlier, 2 hours earlier than standing there in our offloads, we get our crews back on the road that much quicker.
100%. Thank you for that. One more, if I could, Mr. Chair. I just want to touch back on what you were saying in regards to these RAP4s. I think you said regarding the, as opposed to using cabs to get the people to the hospital for these offloads. Two things. First of all, kudos, because the work-life balance is critical for all working people, especially those in these types of situations. And second of all, good on you for thinking outside the box to think of other possible ways to do that. So I just want to say thank you for thinking outside the box as you usually do, Russ. Thanks.
You're welcome. Thank you.
Okay, we're going to go to Mayor Davis.
Yeah, thank you, Mr. Chair, and through you. I'm sorry, I couldn't hear Councillor Pierce's question. But I think from your answer, Chief, what you said was that we're paying the hospital or we're paying an outside nurse to come in and they're devoted exclusively to handling offloading patients that the paramedics bring in?
Through you, Mr. Chair, that is correct, Mayor Davis.
Okay. So looking at those statistics, the statistics that talk about the type of calls that come in and the conditions that people call in for, what percentage would you put into the category of someone who, assuming that we had enough walk-in clinics, that they would more appropriate they go to a walk-in clinic?
Through you, Mr. Chair, looking at the stats, we have patients that would be better suited in a walk-in clinic, but our dispatch center cannot refer them to do otherwise. According to the ministry, if they call 911, a vehicle must be dispatched. But I would say, as an educated guess, 10 to 15%. So if you look at 31,000 calls, 3,000 to 5,000 people would be better suited in our waiting room or through another area. I was talking to Chief Farron in Niagara region, which deals with 66,000 calls. They have a different dispatch center than we do and different authority, and they have a nurse that sits in their dispatch center that can suggest the person taking a taxi. We don't have that ability yet. Currently, as I've said in previous meetings, the MPDS system, our new dispatch system that we were supposed to be launched in 2021, but because of COVID has been delayed, it will improve the types and the priority calls that we go to.
Okay, so is part of the problem in our communities that we don't have enough walk-in clinics?
Through you, Mr. Chair, we need other avenues to defer these patients. So for an example, one of the mitigation strategies we had, because the Brantford General Hospital was always being so full, we struck an agreement with Norfolk General Hospital to do lower priority diversions. If our paramedic crews leave the city of Brantford or the county of Brant and go down to Norfolk and can immediately offload the patient and come back, we get our vehicle back in our hands within an hour to an hour and a half, rather than going to the Brantford General and waiting 3 to 5 to 7 hours. So we worked on a lower priority that way. We have asked the Brantford General Hospital about diversions to, say, the Willett Hospital for the ones that could potentially be in the waiting room area. Those patients and stuff like this, right, we haven't gone that far. According to the Brantford General Hospital, it would basically overburden currently what they're having right now. We don't see the call volume or the flow in the Willett. As I put in my report, and it has been asked in basically the expositor a couple weeks ago, these walk-in clinics are great to take somebody to, but when they close at 7 o'clock, 9 o'clock, or 11 p.m., those patients still would probably have to be transported back to the Brantford General Hospital if they're currently in the middle of treatment or still requiring additional treatment.
All right, so do I understand then from your answer that if we had more 24/7 private, if I can call it that, private walk-in clinics, that would take off some of the load or could potentially take some of the load?
Through you, Mr. Chair, yes, any portion of this helps us to basically decant the Brantford General Hospital, because the Brantford General Hospital is basically the catch basin for people that don't have clinics or don't have doctors or don't have family physicians, right? And when they take their overflow, it comes back to us because, again, We don't take a survey, but I would be hesitant to guess that a majority of our patients with lower acuity don't have daily family doctors, and that's
Right.
what they use us for.
So can a paramedic operating under the regulations, can they take a patient to a private clinic if a private clinic is open?
Through you, Mr. Chair, they would have to have an agreement, just like we had to have an agreement with Norfolk General to take them to that. The province did, in 3 years ago, started the treat and refer program. We can start doing that. Like if, for an example, if we had a mental health crisis center for mental health patients, we could basically, if we had an agreement and St. Leonard's had a larger facility, we could take the patients over to there.
Right. And what does it cost to put another ambulance on in the fleet per year? Include everything: the cost to purchase, the cost to maintain, and the cost of all the personnel required to staff the ambulance. What would that cost per year?
Through you, Mr. Chair, it is, I'll give you the figure that would be gross, not what the provincial government costs, but it's $1 million to staff and operate the vehicle. And current prices right now of a brand new vehicle, brand new, fully loaded with all the equipment, would be about $350,000.
Yeah, and the lifetime of a vehicle is what, 10 years? Or
no, the lifetime of the vehicle, we use them frontline for 5 and 2 years on the back end for spares, and they're not becoming frontline trucks.
So the annual cost, capital cost, would be around, I guess, around $40,000-$50,000. So $1 million is probably closer to $1.1 million.
$1.1 million through you, Mr. Chair. $1.1 million would be staffing, gasoline, insurance, and stuff like this. Right, and $359,000 would be to purchase the vehicle itself.
Yeah. Okay. So have we considered, I know you've considered many innovative solutions. Another innovative solution, which would be kind of an RFP, put it out there to private clinics, that we'd pay them X dollars, or they would offer to provide a service at an amount they would bid on, and provide us with exclusive service 24/7.
Through you, Mr. Chair, not looking at the legislation for a couple years, it would basically, I don't think you would need to do an RFP. It would be the agreements that you would have in place with those clinics, because those clinics would still be paid and I believe funded through the Ministry of Health for any patient they did see.
Right, and with a private clinic, you don't, assuming they're staffing it properly and your agreement addresses it, you wouldn't have like an hour and a half offload time.
Through you, Mr. Chair, we wouldn't have the hour and a half offload time, but again, they may reach capacity at the same time.
All right. So why don't we consider doing that?
Through you, Mr. Chair, we're slowly getting to the process of looking at other agreements, but we're limited by the amount that we have currently in the city and the county.
You mean the amount in our budget?
No, the amount of clinics and private practices that we could defer to in the county and city. Like as I referred to St. Leonard's, it is a good facility, but to the amount that we would bring there, they may not be able to handle our capacity. And again, they do close after hours.
All right, but if we had that conversation with them, well, what would it take for you to provide an exclusive higher level of service for paramedic patients?
Through you, Mr. Chair, that would be conversations that we would have to have with the clinics at that point in time. Again, the province just released the alternate care destinations, and most of the guidelines have just been revised as of this year, so we can start talking about alternate destination guidelines. But it's also, there's a larger process in place, not just having a conversation with them and doing so. We would have to involve the ministry moving forward.
Well, I know you've been looking, and what you told us in your reports today is very familiar. A very similar message has been coming through for the last 2 years, which is like an exponential increase, other than a slight decline during the peak of COVID, but an exponential increase in the demand for paramedic services, which isn't really being driven by, like it's about 20% right now, and I don't really think the community is 20% sicker. I think it's problems that are in the rest of the healthcare system that then fall onto paramedics as the stress relief, so to speak. So I know you've been looking at innovative solutions, and I encourage you to continue to really think about stuff maybe right out of the box, because 20% increase in our budget year after year at some point is unsustainable.
Through Mr. Chair, we are coming up with new ideas, and that's why we're even one of the conversations I had regarding with the chief in Niagara region, right? One of their ideas or innovative ideas was having taxis go and taking people over to the hospital, but they have a completely Niagara, Toronto, and Ottawa have their own dispatch centers, and some of the flexibility that they have, we do not.
Well, why don't we get it?
Through you, Mr. Chair, we are trying to do that through the MPDS system. Should have been here about 2 years ago, but we're working towards it. We already got the radios installed, and that was part of the system, and they were done in August. We're hoping to have us launch in late 2023 is our newest date.
All right. Well, then my last question to you is there anything that we as politicians can do in terms of lobbying to assist staff in getting access to these other programs and services that other paramedic services have been able to achieve?
Through you, Mr. Chair, I believe the best way is for the politicians to help us continue to lobby to get increased funding for our community paramedic program. We've initiated the palliative care and long-term program in Brant County. Those programs defer people being taken to the hospital. We're doing in-home visits. But again, the CP and the long-term care and the palliative care are only year-to-year funding. It is not a permanent program. If it was a permanent program, we would be able to expand, but we're basically held back on maybe next year we're going to get some money, maybe next year afterwards we're going to get some money. So we're doing our best with the funding. Brantford and Brant County have been very fortunate to receive almost $3.5 million in CP and long-term care and palliative funding. Also with the politicians of them basically promoting or asking the province to make the dedicated offload nurse program expanded further to help out the hospital. Our issue with the Brantford General is they're limited with the amount of real estate, and it will get worse when they start the construction in the ER department.
Well, I'll make one last suggestion, and I certainly would take up the cause, and we have a forum for doing that in August, which is the AMO conference. We did that last year joint, myself and Mayor Bailey, regarding an issue with the John Noble home. So I would suggest we begin planning now as to what that might look like as another joint presentation, and the more specific you are in terms of what your ask is, the more likely you're going to get something. So I'd suggest we incorporate that into our planning over the next several months.
Through you, Mr. Chair, I just want to add one other thing. Our OAPC, our Ambulance Paramedic Chiefs of Ontario, also have a seat with the Minister of Health, and whatever documents they come up with to enforce our request, not enforce, but to our request for additional funding, different programs, I will gladly pass on to the committee so we can basically have the same messaging moving forward. And I do appreciate your invite for the August meeting, not for me to attend, but for you to speak on our behalf.
Yeah, well, we can work that out offline, how we might be able to do that, working with the two mayor's offices. But let's begin talking, because the sooner you prepare for it, the better.
Thank you.
Okay, thank you, Mayor. Mayor Bailey, did you want to add anything, or?
No, hello. It's always good with joint services to have both the heads of council lobby at the same time, obviously, and we did do well last time we spoke as a joint service. So I think Kevin's right. We can speak on your behalf. I think right now the buzz, the new pivoting things to do are private clinics, and I think that's the way the province is trying to take us. And so I think that maybe we should find out how that's working, even by just talking to our MPP and find out what they want us to do moving forward, because I know that it's talked about every day right now. It's the top subject of the day is private clinics and privatization. So Kevin and I will speak offline, and we will arrange something for the next conference.
excuse me, any further questions based on, go ahead, Councilor Sokoly.
Not to drag this out, but I do have one quick question through the chair. I'll draw your attention to the chart regarding call types.
Mhm.
I don't see any narcotic or drug overdose related call types. Would that fall under a different category here? Or is it just not as significant as we're kind of being told it is?
Through you, Mr. Chair, it's not a significant number, right? If we drill down to the there's over 200 different categories there. So on an average month, we watch it, we're getting maybe 18, maybe 20 calls in a month, right, regarding narcotics or overdoses. We're dealing with, say, 3,000 calls. That's 0.001% of our overall call volume. The general unwell, the general malaise and stuff is not there. And moving forward, our data collector that we currently had in the past has been bought 2 times over, and those detailed reports and the types of calls and stuff like this, right, will not be available for us overall to be broken down. It'll just be a category number rather than a general malaise, short of breath, chest pain, whatever the categories are. It'll be just basically a code number for us to use afterwards.
Okay. Thank you so much.
Okay, any further? Councilor Martin?
Yeah, the fire department was mentioned. What kind of calls do they run currently?
Currently, right now, cardiac arrest, through you, Mr. Chair, cardiac arrest, unconscious, anaphylaxis, seizures, VSAs. There's 5 to 7 different categories.
Okay.
There's subsets built into those, but there's 5 to 7.
Okay, in Toronto, the fire department was dispatched to a lot more types of medical calls. Is that something that we can do here, or are you limited to the rules that are in place for Brant?
Through you, Mr. Chair, we tried an expanded call volume before with the previous fire chief, which it was not well received, and there was not I'm trying to be politically correct here, right? The in-depth knowledge that we would require. It's basically doubling up on services. If it was used in other jurisdictions, the fire department was used more to stop the clock and improve the overall stats. We appreciate what the fire department does, especially going to cardiac arrest. Our benchmarks in our report, we're below our benchmarks that we set for ourselves in the days of the previous chief in the ambulance service. We're below. We're trying to get those benchmarks back up to an acceptable level. 31% for cardiac arrest to have an AED on site sooner, right, is below even the provincial benchmarks right now. But I would gladly meet with Chief Binkley. We basically have breakfast once a month to discuss new ideas that we could move forward on, and we can bring this out next time we meet.
Okay, because there's lots of times where if it was a patient on the street, we'd get there first and be unable to find the patient. We'd cancel the ambulance. There's no point them responding if we can't find the patient. They won't be able to find them either. Right. Or sometimes we do a lift assist, and they wouldn't even dispatch an ambulance. It was just to lift the person back up into their chair or into their bed. So,
through you, Mr. Chair, that good example you have, Councillor Martin, about doing a lift assist. If a full assessment has not been made and the lift assist was done by the fire service or even the police department and leaving the person there, and they ended up with a result of an injury after the fact, more fire services that we've experienced have gone away from just providing the lift assist without paramedics to sign off on that patient, just as a basically protection of both agencies.
Okay, thank you.
Okay, any further questions? Okay, seeing none, Mayor Davis must have had a look at my notes because he asked almost all my questions that I had written down, except for one. And that is, you use the acronym CTAS, which thank you, Google, I know stands for Canadian Triage Activity Scale. So, Russ, you say the CTS2 for Brantford is a full 5 minutes higher than it is for Oxford, Waterloo, and Hamilton. So what's it set at here then? What's the time that you're trying to hit for CTAS2?
So I'm just going to find my chart. So CTAS2 patients is what you're looking at, right? Is basically to be available on scene and providing care in less than 15 minutes.
So you're saying that some of these surrounding municipalities, it's less than 10 minutes. Is that correct?
No, in other municipalities, the benchmarks that you're looking at for a CTS2 in that is the standard is less than 15 minutes, right? We say for our benchmarking that we basically will meet that or exceed that standard in 90% of the time of all of our calls. Currently, we're at 91%, so we're exceeding the minimum standard of having an ambulance on scene in less than 15 minutes. But if you go to a CTASC 1, it says having an ambulance there in less than 8 minutes, we're below the standard. And if you're the top one, sudden cardiac arrest, having a defibrillator on site with somebody that is in cardiac arrest, we figured we'd be there in 6 minutes or less 35% of the time, and we're only at 31% because of our call volume and availability of vehicles. So we're below the benchmarks that we've set for ourselves.
Okay, thank you. And going back to what Councillor Martin said, I know our fire guys a lot of times will get there much faster than an ambulance simply because the guys are nearby. And I think if you're the one having a cardiac arrest, you don't care whether it's a fire guy or an ambulance fellow. But we'll leave it at that. 21% increase is clearly not sustainable. That's a doubling. If you do the math of every 3.5 years, we just don't have the capacity to double the ambulance service in 3.5 years. We don't. So we see that there's a lot of work going on around the edges. There's a lot of pieces in play. It almost felt like, Mayor Davis, you were going to bring up a motion. I felt you're on the verge of it. But I think the province is working on it, the alternative care, alternative destinations. You say there's rules coming around that. What I would like to see, maybe, Russ, somewhere in some of the future report this year is a report from you saying, these are the options we can go for. These are the new, this is the new legislation coming out. So that's one piece, one ball in the air. Another one is the new BGH emergency department. And how do we get that information back to them that we, or the ambulance service, needs more real estate, because you clearly identified that as an issue, and maybe they already know that. So I'll leave that out there, but I think we got to let them know that that's the case, that these are the needs of us. And other balls in the air, I know we know that there's all kinds of programs going on where they're trying to divert people away from the emergency rooms. I know people directly involved with that. So anyways, what I'm saying is lots of balls in the air. We're going to see some changes this year. We have to see some changes this year because, this is obviously not sustainable. So appreciate the answer to the question, and we'll go to Mayor Davis because he has his hand up.
Yeah. Thank you, Councillor Miller. And I'd say this: we not to say we didn't have it in the past, but I'd say we now clearly have excellent leadership for our committee, consisting of yourself and Councillor Sicoli. And I'm hoping that we don't need to bring a motion, that our excellent leadership will be working with the chief and senior paramedic staff to bring us a report, maybe at our next meeting, what kind of innovative out-of-the-box solutions should we really start pushing for and help our staff achieve, knowing they've got our full support. I've got one question, kind of unrelated, and it comes out of police services where we have a metric, a measurement tool, which is usually the cost per capita. I mean, the amount that a community is spending per person on policing. I haven't seen those kinds of metrics with paramedics. Do we actually have that? Do we keep track of that kind of data, the amount of, let's say, the amount of staff that we have per population, and also the amount that our budget per population, that we can then compare to other services to see how we rank?
Now, I know that information is out there. I don't know if you have it, Russ, or whether Heather has it. And do we have it handy, or is that something we could get together for the next meeting?
Through you, Mr. Chair, we do track that, and in previous meetings, we did have that. Heather's just looking to find it up. If you just give us a minute or two, we'll see where we rank. I believe that we were middle of the road in previous times that we looked at it, but Heather's just going to look for it, and as the meeting goes on, when she finds that information, we'll gladly share it with the group.
Yeah, I'm happy, Mr. Chair, if it's shared whenever it's available, whether it's during the meeting or afterwards.
Okay, fair enough. Okay,
Go ahead, may I? All these ideas that we're coming up with, dealing with the RAV4s and stuff, the previous CAO and I have had conversations on innovative ideas. One of our requests was to have a third party come in and evaluate some of our concepts and stuff. That was our ask in our previous years. And through the CAO and the new CAO right now, we've had further discussions. Bring it to you in a half presented way would not be the most beneficial to the group, but we have innovative ways that would help us all decrease with our call volume. If some of these innovative ways come into play, it would go from about 106% capacity down to 78% capacity with, I would say, in dollar wise, in my calculation, this is why we need the third party to validate our ideas. For spending $1.5 million, we could basically decrease our overall capacity with our ambulance service. But again, it's only in the preliminary stages. We are working on a lot of things in the background to benefit this. We're not just continuously, I need a new truck next year, I need a new truck next year. We're trying to come up with new ideas that benefit the community, because the community and myself and Mayor Bailey were talking at the beginning of the meeting, the growth that we're experiencing on both the county and city. The healthcare system is not going to correct itself overnight. We need to come up with new ideas, and we do have a few plans in place. We're just not there ready to present it to the group as of right now.
okay, thank you, Russ. No, it's good information. But information without action it's meaningless. So I think we all recognize the problem. We're going to see a couple of reports from you, Russ. Sorry to throw some more work on your plate, but we want to try and get it down. If I don't see any more questions, I'm going to call the vote to receive. All in favor? Opposed, if any? Thank you. Okay, we'll go to item 9.2, and this is Heather's report regarding the paramedic services budget to actual variance at the end of 2022. Again, it's for information purposes only today, so can I get a mover to get that on the floor? Moved by Councillor Martin, second by Councillor Pierce. I'll open it up to the committee if they have any questions or comments at this time. Again, given that it's an information report, unless Heather wants to speak to it. Heather, is there anything you want to draw to our attention that? No, I'm just available. Okay, and any questions for Heather? Councillor Pierce?
Thank you, Mr. Chair, through you to either Heather or Russ. And I know we've talked about it in the past with regards to the provincial funding, the 50% and that sort of thing. And, you know, it's been a few years now that they've given the 50% with no inflation. And I know there's been discussions in the background with a lot of people about that, with a lot of different municipalities, because everybody's in the same boat there. Has there been anything, like I say, we haven't met in several months here. Has there been anything new discussed or anything on that the province may just, you know, give that inflation, or are they just going to continue to give the 50% of the year before, which, as we know, puts us in the deficit right off the hop?
Through you, Mr. Chair, our OAPC speaks on behalf of all the municipalities across Ontario. They've got a chair dealing with the Minister of Health, and they continue to push to have true, what they refer to as true 50-50 funding. They continue to push on behalf of all the municipalities. The response back is we'll continue to look at it from the ministry. But that is on one of their top agendas, because our deficit of, say, $77,000, if you go to Toronto, that deficit could be $3.8 million, right? The size of the service and what we're dealing with. They continue to push and be our voice with the Ministry of Health.
Good. Thank you. Well, not good that it's not happening, but good that we're continuing to push. Thank
Correct.
you.
Just an addendum to that. We at AMO made the presentation before Sylvia Jones. Well, I thought is a good minister, pretty receptive, and she knows that was one of our requests in the delegation. If everybody was shared on that presentation, and so they know it's an issue, but I think it's just something we got to keep pressing on. Mayor Bailey, okay, and you were at that meeting as well. So, but I thought it was a pretty good meeting. Any questions for Heather on the report? Okay, I just have one. It says in there, discussion with county's neighbors to discontinue cross-border payments. I don't understand that. If we're not paying for cross-border payments, if we're not paying for them, maybe what does that look like?
Through you, Mr. Chair, when the downloading started back in 2000, they allowed other municipalities to charge if they did a call in our area, still allowing it to be seamless. So, for an example, if we went into Hamilton, we could basically bill them. I think the current rate right now is $221 a call. I don't have the new 2023 rates right as of now. And at the end of the year, we basically go, I did this for you, you did this for me, whatever's left over is a wash. So we could owe Hamilton for 100 calls, or Hamilton could owe us for 250 calls, right? It washes. So in our existing report that we provided, we did over, other services did 1,900 calls in our area, but we only reciprocated 451 times. Talking with our other chiefs in our area, basically we're trying to come up with a system that nobody charges anybody. Just leave it alone for now. It takes a lot of man hours. The discussion started in January. Again, when I get to that next level, I will bring it to our CAO for further discussions regarding it. The chief of Haldeman County will have to bring it to their CAO and their appropriate council to say we're not going to bill. But currently, right now, the billing's in place, but the conversation has been started.
Okay. Any other questions? Councilor Pierce?
Thank you, Mr. Chair. Just to add on to that. So, Russ, if we get ourselves into that situation, that, you know what, everybody's going to play nice in the sandbox, nobody's going to charge anybody else, that kind of scares me a little bit in the sense that, and I'm not saying that it's going to happen, but the potential is out there that potentially other municipalities, and I don't think we would do it, but you know what, we're not getting paid for this, we're not going to do that. Or are they legislated, are they mandated in order to do that if another municipality calls for assistance?
Through you, Mr. Chair, every service has what they call a deployment plan, and written in our deployment plan that we will help other communities. Originally, the other communities was that, we'll say, a lower priority call could be held up to 30 minutes before they would ask for assistance in other jurisdictions. Other communities have now written into it, well, if it's the first 30 minutes and nobody is available, and then 30 more minutes, and 30 more minutes, right? So it seems to be like a rolling option to come in, but they are mandated. Once they're dispatched from our dispatch center, being politically correct, does not play games. The call is committed to that service, and no matter if it's Six Nations, Haldeman, Norfolk, Waterloo, or whatever the case is, once our crews are committed, it's that. But we have a deployment plan to look after our community and also help our neighbors.
Good to know. Thank you.
Okay. See no other questions, I'll call the vote to receive. All in favor? Okay. Okay, so we have the agenda slightly altered today. So at this point, there's no communications on the schedule. So we're going to go into other business, and as per the amended agenda, that's going to be an in-camera one. So I will need a motion to go in camera. Moved by Mayor Bailey, seconded by Councillor Martin. Okay, all in favor of going in camera? Okay, approved. So anybody Okay, so we go to the last item, next meeting. Normally we meet the first Wednesday of the month.
It's a new term, so it's up
Yes.
to the committee as to when they want to meet.
Historically.
Historically, you can meet quarterly, and if the first Wednesday of the month at 10 o'clock works, we can carry on with that.
Okay, so let's propose that it is the first Wednesday of the month. We're here at 10 o'clock. Does anybody got any suggestions or can't make it or? And having said that, I will say, anytime you change a meeting, it is so hard. But anyways, okay, this is why we're having the discussion. Councillor Segoli.
Sorry, did you say it was quarterly or every month?
She said
Okay.
quarterly.
Okay.
But,
Okay.
but I'm going to change that. So, and the reason is, you've read the reports, right, today. There's a lot of moving pieces. I would like to keep on top of this. From the emergency room being rebuilt, from the offload nursing to the new, well, okay, I shouldn't say what other things we talked about, to the incredible increase in year-over-year numbers. I think we need to keep on top of it. We have a problem. We got to fix it. We got to deal with it at least. I don't know if we can fix it, but we got to deal with it. So I'm going to suggest that we meet monthly. If there's a reason we don't meet, obviously we don't meet for no reason, but I think we need to, for now, to schedule it monthly.
There's a social services. That's why I'm asking.
Yeah,
Which
and,
I believe we'll all be at. Well,
and
not
is
all.
that the first or
It's
is it
the
the second?
first Wednesday of April,
First one, okay.
which is April 5th. So I just thought I'd note that.
And that social
Conflict for us?
and that social service is awkward because sometimes it's the first and then sometimes it's the second. Councillor Pierce.
Mr. Chair, what if we looked at, and I appreciate what you're saying there, but what if we looked at meeting bi-monthly? That would double the number of meetings we have right now.
May I add one thing, just so you know, regarding the call stats? I forgot to let you know, we pulled the stats for January, and we were up 7% from previous last year already. 7.7%. So we're still growing with the amount of call volume that's happening out there.
Let's I think we will try the bi-monthly then. I think we need to meet more than quarterly is what I'm saying. We'll leave it at the. Let me check with social services because, like I say, sometimes they meet that first Wednesday, sometimes they meet the second. So, what we'll do is we'll try and coordinate it with that. And well, obviously we have to, so we don't conflict. But we're going to try and keep it basically on the Wednesday 10 a.m. if that's okay with the committee. Mayor.
Well, I'm just going to suggest that if this is sort of the bare bones of the committee, I would hate to see, I can't guarantee I can do that without checking with my office, but I'd hate to see you try to meet and not have quorum. So let's send something out through the clerks to make sure that everybody can do it. If we can do it, we'll do it. If we can't do it, we can't do it.
Yeah.
I just can't commit without looking at things.
Okay. Understood. Councilor Martin?
Given that social service meets Wednesday mornings, would a Tuesday or Thursday morning be better for this committee to meet?
We're so busy on Tuesday.
Yeah, Tuesdays is.
Thursdays, is there any issues with meeting on a Thursday versus a Wednesday?
Again, Mr. Chair,
We would check with your schedule.
I don't
Yeah,
know
yeah.
without looking,
Yeah. From my end, I'm okay. Councilor Pierce, if you gave up a Thursday versus a Wednesday, you're okay? I don't know.
Police services is Tuesdays, EME's Thursdays, that's the afternoon.
Yeah.
Let's put it out there and see how it goes. But like I say, does the 10 a.m. work for everybody? I think that's.
10 a.m. is fine with me. Is it fine with you? Okay. So what we'll do, we'll leave it with Nancy to send out an invite for 2 months from today. Russ, is there a pressing well, obviously everything is at the call of the chair. If we need to, and we discussed that earlier, that we will have to do that. And I know you got to get going. But it is 2 months from today. You think, is that going to work for you?
Through you, Mr. Chair, this committee has always been supportive that if in the event that something becomes urgent or pressing and stuff like this, right, the communications is right there for everybody to share. I think, as Daryl said in our previous discussion in camera, that we may have to have a other meeting sooner than later, but 2 months right now would be ideal. And again, the committee's always been supportive. If we need anything right away, that we can call a special meeting.
Okay. Okay, so we'll shoot for the we'll shoot for the Thursday. Councillor Pierce.
Yeah, Mr. Chair, and the reason I was asking, like, and I'm more, for the ones that are coming in, like, if we were to back it up to 9 a.m., would that make it better or worse, or? No, I understand that. No, I'm just talking
different day, different day
regardless of
though.
the day that it's
Yeah.
on. Would 9 a.m. be better?
Okay, you had your hand up.
No, sorry.
I personally prefer 9 a.m. just simply because, it gives you that. Are you okay with 9 a.m.? Okay. I see your pillow out back, so and your blankets. Okay, so what we'll do, we'll shoot for Thursdays, and we'll shoot for every other month. Obviously, again, if we have it at the call of a chair. But again, I appreciate the input because, like I say, from what I'm seeing, there's a lot of moving parts. I think we got to keep on top of it. Everybody knows we have a problem. Let's do that. So I'll leave it up to Nancy to send out the invite for two cycles from today, or 2 months from today. So that'll take us to May, first Thursday of the month. We'll keep it the first week if we can. And obviously, if it's a problem, we'll have to reconsider that. And I'm aware of that. I know.
At 9 a.m.
Yeah, 9 a.m. And I wouldn't be shocked if I sat down and found out I had a conflict. But
There's two of them.
well, I'm not touring, so
I know,
yeah.
the mayor is.
Okay. Okay. So we'll shoot for that. And any other discussion before we? Okay. So motion to adjourn.